Hello everyone and welcome back to the channel. My name is Rupan. I'm an oncologist, and through this video I want to share my ideas and my thoughts about whole body MRI. Okay, so just a disclaimer, as you noticed, I'm saying my ideas and my thoughts. So these are my thoughts, my ideas. It does not reflect the ideas and the thoughts of the people I work with, my employer, the universities I work for. So it's just me expressing my ideas through this channel, through this video about whole body MRI. Before jumping in, so let's clarify what is whole body MRI and what kind of whole body MRI I'm talking about. MRI is an imaging technique that help us to obtain images of the body, usually using a magnetic field. So there is no radiation. And that's the beauty about MRI. Unlike CT scan or X-ray, where you have like radiation exposure, this is not the case when it comes to MRI. MRI is used to diagnose different medical conditions. Sometimes a stroke, sometimes liver lesions or skin lesions or any other like cancer or non-cancer related condition. So it is used in many conditions. It's an imaging modality that helps us to look at the body organs. And it can show if there is a cancer, or it can show if there is like an inflammation in an organ or a tendon, or fluid accumulation, or abnormal signal coming from the bone marrow. So it's an imaging technique. And the beauty of it, as I said, it does not involve radiation exposure. However, over the last years, there was some advocacy, and some people advocated of using a whole body MRI for cancer screening. And this came from people who have or don't have medical background and usually have some influence, and they have enough income to afford this technology. So whole body MRI costs tons of money. It's an imaging technique that scans the entire body from the brain up to the bottom of the feet, looking for cancer or any other medical conditions. Sometimes it can help also to diagnose rheumatological conditions that affect the bones and the joints early, because it can show inflammation in these organs. Also, it can help to diagnose blood disorders or blood cancers that start in the bone marrow, like multiple myeloma. It also can help in diagnosing heart conditions. So it's not only for cancer, but also it helps to detect many conditions that arise in different organs, right? And so I want to talk about how we can use this, or should we use this imaging modality in cancer detection, and where my advocacy is coming from. So let's jump in. The question now is, how much do we spend on cancer prevention versus cancer treatment? In 2022, in the United States, spending on healthcare was around $4.5 trillion with a T dollars. Out of that $4.5 trillion, only 3.5% was allocated to prevention. And that includes cancer prevention. So cancer prevention is subcategory of the health promotion and prevention that the United States does for its population. So 3.5% was allocated to prevention. Out of the 3.5%, 1.3% was allocated to cancer prevention. So in other terms, if we have $4.5 trillion, $58 billion for cancer prevention, and the rest for other healthcare expenditure, including cancer treatment. Let's put it another way. If you are spending $4,500 on your health each month, for example, you are only spending $58 on cancer prevention. So the number is very small. On the other hand, we spend billions of dollars on cancer treatment. Breast cancer, which is one of the most common cancers, on its own usually costs around $30 billion to treat in the United States, which is like the half what we spend on prevention. So if we combine all cancers, for sure, we spend more on cancer treatment than cancer prevention. And that's where my passion to whole body MRI or any other screening tool comes from, because I believe in cancer prevention. I see tons of patients every day, and we do have good cancer treatments, don't get me wrong. Right now, we have targeted therapies, immunotherapies, antibody drug conjugates, and we have treatments that help patients. But there are still many cancers that we can't cure, we can't treat, we can't even control its progression. So that's why I'm a big advocate of cancer prevention rather than treatment, because if we can screen and prevent cancer from happening, or screen cancer and detect cancer in its early stage and prevent it from spreading, treating cancer in its early stage is much more easier and can be done with a curative intent rather than treating it in an advanced stage where it's done only to control the progression of the cancer. So the bottom line, we don't spend a lot on cancer prevention or screening. when compared to what we spend on cancer treatment. Now the next question is, so what are the current cancer diagnostic tools? There are hundreds of types of cancers, but maybe we have 5 or 6 cancer screening tools. So we have the mammogram. The mammogram, it's a type of X-ray that is used to screen for breast cancer in usually women who are 40 or older, or sometimes younger if they have high-risk features. We're not going to go into the details. We have the colonoscopy, which is inserting a camera to the bowels and looking into the lumen of the bowels and looking if there is any cancer. There is the pap smear and the HPV testing, and these are usually used to screen for cervical cancer in women. We have the low-dose CT scan. It is used to screen for lung cancer in high-risk patients who have a smoking history or currently smoke. We have the prosthetic-specific antigen, or the PSA, which is a controversial test. Some physicians might offer it, some physicians might not. And when it's offered, always should be discussed with the patient about the risk and the benefit. Also, sometimes we might do a skin exam and dermoscopy to look at any skin lesions for patients who have high risk of developing melanoma or other skin conditions. And that's it. We don't have a tool that's screening for all cancers, and we don't have a screening tool for every and each cancer. And despite this, that we see cancer in many young patients. I see cancer in many young patients, and that is the most frustrating part of my job. And this is the most devastating part and emotionally tiring part of my job as being an oncologist. I see cancer in young patients. 3 of my friends back in residency were diagnosed with cancer. 2 of them I knew very well, unfortunately. And even if I don't know them, this is hard. Cancer diagnosis is hard. In your 20s or in your 30s, you are dealing with life things like getting married, having kids, and it's so devastating to see people dealing with the decision of, should I choose chemotherapy or should I choose immunotherapy? Which one is going to help me to live 10 to 15 years? It's very hard. It is very devastating. And I see these cancer patients, and unfortunately, these young patients are not included in the guidelines. So cancer can happen even in the young patients. Now let's talk about, what do professional societies say about using whole body MRI in cancer screening? What do the NCCN guidelines, or MD Anderson or Dana-Farber? So these are big names in cancer treatment. These are big institutions. So MD Anderson or Dana-Farber or the American College of Preventive Medicine, even this body, they recommend against using whole body MRI as a tool to screen for cancer. And I understand where they are coming from, because we don't have evidence that using whole body MRI will be beneficial, will be helpful in prolonging the survival of a X or Y or Z population. The problem, part of it, is we also lack a strong evidence. So where this institution is coming from is, I haven't heard or I haven't read any randomized clinical trial that looked into cancer prevention using whole body MRI in A population, and they compared this A population to B population where they are not doing whole body MRI, and calculated which population lives longer, the one that is getting whole body MRI or the one that is not getting whole body MRI. This is usually how evidence is generated, through a trial. We try an MRI or a drug or an intervention in a group 1 versus we don't try it in a group 2 and see what happens. So we don't have such evidence. And of course, there are many reasons for that. One is whole body MRI as a technology is very expensive. To do a whole body MRI on a 1,000 or 2,000 or 3,000 population to generate that evidence requires tons of money. And usually there isn't, if you do that kind of study, who is going to sponsor it? So that brings me to, usually clinical trials are sponsored by pharma companies, because let's say they have a drug and this drug is beneficial. So they are able to afford the study of studying this drug in XYZ population and seeing if this drug is beneficial. But when it comes to prevention, unfortunately, there isn't enough interest, or there isn't enough bodies or entities that are willing to spend money to see if using whole body MRI or any other cancer preventive tool is cost effective. So we lack evidence. And based on my understanding is, lack of evidence does not equal to harm, or does not equal to no benefit. I think we just don't know. And I think we have to study whole body MRI and see if it is really beneficial. And that brings me to the other point. Okay, so if you're going to use whole body MRI, what are the cons of whole body MRI and what are the pros of whole body MRI? Now we're going to talk about the pros, the cons, and the barriers of using whole body MRI, and what are the things that needs to be changed to whole body MRI be considered as a really effective tool in the screening the mass population. So the pros. Pros is like, it helps you to know if you have cancer or not, or any other medical condition that is developing in early stage. Sometimes rheumatological condition leads to inflammation in the joints, so you might figure out that you have rheumatoid arthritis early on, if you have a strong family history, if you have other medical conditions that predispose you. Sometimes whole body MRI can also help to detect bone marrow problems like multiple myeloma or other conditions that arise in the bone marrow. Sometimes it can help to detect heart conditions, so it can help to diagnose medical conditions, including cancer, earlier. And the second thing is the peace of mind. Of course, this is a double-edged sword, as we're going to talk about. People are becoming more proactive. Like if you go to any social media, like YouTube, Facebook, Instagram, there are tons of social media pages or resources for you to help to live healthier. And there are these group of people, biohackers, who try to hack their health through taking supplements or whatever. People want to be healthy. People want to live longer. Of course, there are a group of people who don't want to know if they have cancer, and they just like, if it happens, I will deal with it. So the pros is like, it helps you diagnose medical conditions earlier, and also the peace of mind, which is double-edged sword, as we're going to talk about. What are the cons of whole body MRI? Let's say you go and do a whole body MRI, and we found that you have a lung lesion. This will trigger referral to an interventional radiologist or a lung doctor. So one of them, someone who is specialized to take a sample or a biopsy from the lung. Of course, the biopsy itself comes with side effects. There is a 1% chance of causing maybe more, maybe less. Don't quote me on the numbers, but there is a good chance of like having pneumothorax, which is accumulation of air around the lungs after the procedure because we're inserting needle to the lungs. There is a risk of bleeding, there is a risk of dying, there is a risk of infection. So the biopsy itself, so once we find something on the whole body MRI, we do biopsy, this biopsy comes with also with side effects and also risks, let's say. And then this sample is going to be sent to a pathologist who is going to look at the tissue and cut it into slices and study it under the microscope, and then it's going to tell you if it's cancer or not. As you can see throughout this process, you utilize the time of a radiologist and a pathologist and healthcare resources. And eventually, the sample or the mass that we found in your lungs can be normal. There are tons of incidental findings. There are tons of things that nodules or suspicious lesions that we find, and we biopsy it, and the biopsy comes back normal. It's nothing. So the cons is more investigations, anxiety that you spend waiting for the results of the investigations, at least takes 6 weeks, the money and the resources that you used from healthcare. Now, that brings me to the third point. What are the barriers? As you can see, the barriers is, one, we don't know which lesions, or we have general idea about what to biopsy or what not to biopsy, but we don't have enough data of using whole body MRI in the general population as a screening tool. So we have to learn and generate enough evidence. Another barrier is the cost. We usually use whole body MRI in healthcare and for medical conditions, but outside of that, if you're going to go and do whole body MRI, you're going to pay out of pocket. Insurance doesn't cover that. Usually it costs $2,000 to $2,500. The third barrier is we utilize the time of a radiologist who has to read the images. We don't have an AI algorithm to read the image and immediately tell you, okay, so this is normal or this requires the attention of a radiologist. And finally, the fourth barrier is if there is something suspicious, we are utilizing healthcare resources that can be utilized for other people because you need a radiologist, you need an interventional radiologist to take the biopsy, and then you need a pathologist to read the images. So there are tons of utilization of healthcare resources. Now, in my opinion, how do we come over this? How do we overcome this, right? So first, the cost of the technology is not there yet. We have to have a cheaper whole body MRI machines. This technology to be used, it should be much cheaper. Like it should cost around $200, $300, maybe max $500, and even cheaper. Anyone should go and get it. Two, we should have an AI algorithm that is able to read the images and if there is something suspicious, to tell the radiologist, okay, so this is something suspicious, you have to take a look. We should not relay mail on radiologist to read the images. We have to have a highly sensitive AI algorithm that is able to read the images. 3, we have to generate enough evidence. We have to use this tool in a general population and follow a population for a period of time. And sometimes we have to do biopsies and investigations to figure out which lesions need to be biopsied, which lesions don't need to be biopsied, doesn't need to be biopsied, and generate a new type of science of using whole body MRI in screening. And eventually it might or might not work. So these are the pros and the cons and the barriers and how we can overcome the barriers to utilize whole body MRI as a cancer screening tool. Now the main question, would I recommend using whole body MRI for cancer screening? Let me answer it this way. I advocate to use any tool that help in cancer prevention and early detection. And this is mainly coming from the frustration, the fear, the anxiety, and the sadness that I myself experience every time I see a young patient with cancer. I advocate for using more evidence and more resources to study whole body MRI in the general population and see if it is really helpful in cancer screening or early detection. We should generate an evidence, and if there is an evidence of harm, then we should stop. And we should put much more effort on cancer prevention and early detection and cancer screening rather than cancer treatment. Because to be honest with you, I'm tired of seeing young patients with cancer. It is devastating. And we are doing great when it comes to cancer treatment. We have tons of new drugs, but there are tons of types of cancers that are not cured, and we don't have a cure yet. They are still deadly. So I advocate to use any tool or resource to prevent and screen for cancer rather than focus on treatment. It could be whole body MRI, or it could be any other tool once we have enough evidence. It's something that I hope that societies and entities study more, put more money in it, and maybe one day the technology will be cheap and patients can decide themselves after weighing the benefit versus the risk. Do I want to use whole body MRI in cancer screening? Do I want to go through the process of lying 60 or 70 minutes in the machine? I might find something that will cause me anxiety. I might or might not intervene on it. I might biopsy or might not biopsy. So there are many questions that comes through with doing whole body MRI. Doing whole body MRI is step 1 of many steps to ensure that you have or you don't have a cancer. So the bottom line is I advocate to use any tool that helps in cancer prevention, screening, and early treatment. I hope you liked this video. If you have any questions, leave them in the comments below. I wrote an article about whole body MRI. It's on my LinkedIn profile. You can check it. Also, I will leave the link in the comments below. If you have any questions about whole body MRI, please leave it in the comments below. I would love to hear your thoughts. Have you done whole body MRI? How was your experience? What do you think about whole body MRI as cancer screening and as a tool to detect cancer early? I will see you in the next video.